Any more comment or question? So time has come to the last lecture, and I ask my co-chair, Dr. Molnár, to deliver his lecture, Effect of Reduced Deuterium Content of Drinking Water in STZ-induced Diabetic Rats and in Humans with Altered Glucose Metabolism, please.
Look, I have the glasses. Okay. This is one. And I open Gábor's lecture as well. All right, ladies and gentlemen, this lecture was presented partly in 1 year ago. And I'm a skepticism, so I have skepticism a lot about this deuterium, but I have to believe some part of it. So basically what we started, maybe you remember whoever was here 1 year ago, that the aim of the study that we started, that from the clinical data came out that somehow those patients who taking depleted water, they did have a lower sugar level, especially on those patients who was, let's see, used insulin. Those patients had to adjust the insulin treatment. They had to reduce the insulin they were treated with. Now, this is why we came to the picture, and Gábor approached me, okay, so set up an experiment and let's look at how this deuterium depletion work on the insulin effect. And we used the animal model, so we used the streptozotocin that induces type 1 diabetes in rat, and we tried to apply this depleted deuterium, how this depleted deuterium works on the system. Now, first experiment that I presented last year, we could present that depleted deuterium water only could work or could reduce, let's see, the glucose level of the animal, whoever was treated with insulin. So without insulin, the deuterium depletion did not work at all. So it looks like we had to have the signaling transduction to introduce or to influence the glucose metabolism. Now, in this next setup of experiment, we try to adjust the right dose of deuterium depletion. And as you see, we went down all the way to 25 ppm from 150. And first of all, we made the animals diabetic one. And after 1 week, the diabetes was fully developed. We applied this treatment for different groups, and we measured the glucose level in the serum. We measured, let's say, the glycation product, the fructosamine, and the hemoglobin A1C level. And of course, we measured the kidney function, the creatinine, the protein excretion, and so on. But usually during this short period that we examined, up to 4 weeks, did not change at all. And we measured in the urine the glucose and other substances as well. Now let's see how the glucose level changed in this animal. Now, if you look, this is the dose response, how, let's see, the depletion a little bit going backward, because that's a naturally occurring 150 ppm, and this goes all the way back. It looks like this curve, this is a magnified portion of the curve, it looks like has an optimum. This optimum was around 125 and 140. Now, that's a good one if I want to compare or want to translate to the human patient, because a rat can drink the same volume that the body water has. So it's about, normally the rat drinks about 30 ml of water, but the diabetic can drink about 200 ml. So about the same as their body weight. So this way, relatively in the rat, they can exchange the all, let's see, deuterium completely. Now it looks like it does has an optimum when we applied 1 or twice 1 unit per body weight, 300 or 100 gram body weight of insulin to the rat. And as you see, comparing to the 40 or 45 millimole of the glucose, these animals with the same amount of insulin, they decreased about 15 millimole of the glucose. Now, and about the same way, the fructosamine, the glycated product changed the same way. So the optimum was about the same range between 125 and 140. And with hemoglobin A1C level, we did have very similar data. After we have evaluated for the insulin excretion, insulin metabolism of this animal, and we did not find any difference between these animals. So the insulin level that we ingested, the human insulin, they didn't disappear faster or slower in the treated animals. So it looks like there is not an explanation why the insulin could work maybe more effectively in these animals. So after we turn our focus on the GLUT4 transport system, because the major glucose transport system that needs insulin, this is a GLUT4 transport system in the adipose tissues or in the skeletal muscle cells. Of course, we can train, but the animals cannot move too much in the cage. So this way, they need insulin to have a translocation of the GLUT4 from the cytosol to the membrane, and that can transfer, let's say, the glucose inside the cells. And it looks like you can see this representative tracing of the Western blot of the GLUT4 protein in the animal that obtained this muscle soleus from the animals, and after they put on the slab. And we could present very similar data that it looks like around 125, that was the maximum as a major dose of the, let's see, the GLUT4 protein level that transferred to the membrane, and looks like that's an optimum in our case. So maybe this is the data, this is the results, how this depletion can somehow potentiate the translocation of the transport system and can take more and more glucose, similarly maybe to the exercise. We don't know. But there are some data that they use some, for example, deuterium. They used to use to conserve the microfilament, or somehow they stabilize the microfilament system inside the cells. And if you do decrease this, let's say, deuterium, it could be more soluble. So maybe it's much easier to translocate this protein to the membrane. Now, this is our results, a conclusion that, yes, type 1 diabetes could be developed by using the streptozotocin. There's nothing new with it. And the lowering of the deuterium, however, can decrease the glucose level, can decrease the glycation product. So looks like can be used in an additive treatment beside of the insulin. Of course, that would be very good, and after we did focus on another aspect. The insulin-treated patient is not the best, let's see, population that we are using this deuterium, because when we introduce the deuterium, the depletion, the patient should adjust, let's see, the insulin treatment, depending on the movement, depending on the exercise, depending on how much water is ingesting. So this can somehow interfere with the normal insulin treatment. But this would be very valuable to treat type 2 diabetic patient. Because what's the problem in type 2 diabetic patient? Insulin resistance. Those patients usually they do have a higher insulinic effect, but the insulin cannot work on the receptors because they are not taking, let's say, the glucose efficiently into the skeletal muscle cells or adipose tissue cells. This is why, and this is another topics that Gábor is going to talk about, we went to the clinicians. Let's choose some patient who is taking some, let's see, deuterium depletion water, and how this patient and the glucose level of this patient changes. And I think that will be more interesting than my red data. So please, Gábor, come and present your story. Because everybody is happy about that the rat will be happy, but the human should be happy.
Okay.